Hello, my beautiful people. How are we doing today? I trust we are all doing fantastic. Dr. Precious here to answer yet another question. So today I do have my white coat. I'm not wearing it because it's a little hot in here and I'm drinking a hot tea. So before I continue, we're going to discuss this hole in the teeth. The question is everywhere. So we're going to talk about it today. But before then, let me tell you what I'm drinking. I'm drinking a hot ginger tea, and yes, I made it myself. How did I make it? Let me tell you real quick. I got some ginger root, I peeled the back, and I blended it with a little bit of water, and I sieved it, and I got the shaft separate from the water. The shaft I can still use to make stew. Yes, you can still use it to make stew, so don't throw it away. It has fiber and it has the goodies of ginger in it still. So I now took the water, the concentrated ginger water that I have, boiled hot water, put like maybe 1/3 of the ginger water and then maybe 75% of water, and I put some stevia in it, not sugar, stevia, to make it a little sweet. And this is yummy. Try it and tell me in the comment section what you think. I might give you more health tips in the future, but I was just drinking this and it just came to me to tell you guys what I'm actually drinking. So back to the issue at hand. We are talking about hole in the teeth. This question is coming from my very own queen, and I'm going to read it. It says, please, what causes hole in the teeth and what are the preventive measures or solutions to it if someone already has it? So this particular question have been asked in several places, okay? But we're going to pick this one today. They are in different forms, but we're going to answer this one today. And this is actually a two-part question, because the first question is what causes hole in teeth. The second part of it is what to do about it if it has already happened. So let's focus on the first question first. What causes a hole in your teeth? As Dr. Precious, and yes, I am here to answer. Now, let me ask you, what is in your mouth? What do you think is in your mouth other than your teeth? Of course, I know your teeth, your tongue, your palate, everything is in your mouth, but what else is in your mouth other than that? I will tell you, bacteria. Hundreds and hundreds and hundreds of bacteria live in your mouth. They live in mine too, in hers too, in his. Everybody, we all have it. And before you go telling your significant other, your boo, your bae, your hubby, before you go telling them that there won't be any kissing anymore because of bacteria, let me tell you, you never reach there. My Yoruba side will say kotobe. No be so, because they are supposed to be there. They are meant to be there. They have a purpose for being there. Okay? So, the problem is when there's an overgrowth, when it's too much of them or when they do too much, is when there's a problem. Again, I'm going to keep this all in simple, very simple terms, okay? So now what happens to these bacteria? Why are they a problem? Remember, we're going somewhere. We're trying to establish why there is a hole in your teeth or in his teeth or in somebody's teeth. So these bacteria, they get fed by the food you eat, especially sugar. So you see that Sprite that you like, you see that birthday cake that you just want one more bite of, you're feeding the bacteria. They're having their own party inside your mouth. So these bacteria, they utilize the sugar in our food to produce acid, and this acid begin to attack your teeth. it begins to attack your teeth, and your teeth, if you remember from our previous video about fluoride, we talked about enamel. We talked about how enamel contains a lot of minerals. And what happens is this, because of this acid, you're attacking these bacteria, they actually produce a little film on the surface of your teeth that is called plaque. So it begins to demineralize. It's a word that I can't even say. That means it begins to lose the minerals in your enamel. That is what happens. And this thing begins in a very micro level. Small. Before you know it, consequently becomes a big hole. Now, let's go back again. How did we get there? So let me use this illustration. There is always a war going on in your mouth. This war is every minute basis, every second basis, constantly. Who are the people fighting this war? On one side, you have this bacteria with their acid attacking your teeth. On the other hand, you have, if you remember from the fluoride video, you have the fluoride from your water supply, your topical fluoride from your toothpaste, you have that. And you also have other enzymes from your saliva that is combating the action of this bacteria. And your saliva actually neutralizes this acid because your saliva is on the base side. If you remember that number we did in school, in high school, from 0, most acidic, to 14, least acidic or most basic. I actually remember those numbers. Most basic. Okay, saliva is somewhere in the middle, so they neutralize this acid. So this war continues all the time, and when that happens, it begins to deposit those minerals back into your enamel, and then the bacteria and the acid will come again, take them off. Then the saliva and the enzymes and the other things that God put there for your protection will come back and put the minerals back, and your teeth will get stronger again. This keeps happening till one side wins the war. For example, let's say the bacteria wins. You're eating, there's constant exposure. You're constantly eating a lot of sugar and you're not brushing properly, and it's staying in your teeth. Those plaques continue to stick to your teeth. Eventually, they're going to outweigh the other side and they will win the fight. And that is how you have a cavity. And those cavities starts, like I said before, micro cavities, small, till it becomes a big one. So that is what happens on that end. Now, let's continue. There are other factors that I want to talk about that can also contribute, other than what I've already said. So there are things called risk factors, like there are people that are more likely to get it because of other things. For example, if you like to eat acidic food, still we go back to soda, we go back to lemon, we go back to things like that. Food that have a lot of acid. You are further exposing your teeth to acid, other than the one that is being produced by the bacteria. If you have any disease process that is causing you to produce less saliva, which there are things like that, there are disease processes that can cause one to produce less saliva. It will also make you to be susceptible to this cavity we're talking about. There is stress. I've talked about a lot of things in this channel, and I've noticed that everything still boils down. We still talk about stress. So this stress thing that they've been telling us about, it affects everything. So anything to keep your level of stress down, do it. Because once you're stressed, your immune system is also stressed, and it makes you once again to be more susceptible to attack by things, bacteria and other things, even the common cold. So stress is also one of them. And then habit. Do you like to chew things? Do you like to chew? I don't want to talk about bone. Oh. Let's leave our bone. Do you like to chew hard objects? Do you like to open your drinks with your teeth? Do you grind at night? These are things that can further expose your teeth to attack because you're still causing some micro damages. You're still wearing away mechanically those enamel. This will further expose your teeth to danger. There is also medication. There are some medications that can cause you to have reduced saliva flow. There are some disease processes that may cause that to happen as well. There is genetics. Some people are more likely to get it than others, or some people will get it quicker than others. There is radiation. If there's a disease process that may have caused someone to get radiation, that may also affect the mouth. So there are so many things that combine to cause this to happen. They are called risk factors. And now there's good news. The good news is that there are also things that you can do to protect yourself. There are things that you can do to keep these risk factors down. There are things you can do to prevent these cavities from happening, or these holes, or at least reduce the rate or the severity. That I will do in another video. But now let's continue. So the second part of the question says, what will you do when you have had it already? The hole is already there. What do you do at this point? You have to see your dentist. You can't escape it. You can't. You have to visit your dentist. You're actually supposed to see your dentist on a regular basis anyways, at least twice a year, so they can catch these things before they get out of hand. So you have to see your dentist, and your dentist will be able to determine the level or the severity of the disease process. There are certain situations that so many treatment options. I know some of us think that the only solution is to pull out the teeth. No, there are other options. But these options, which again, I may have to discuss in another video, but when it's so severe that there's nothing that can be done at that point, you may lose the tooth. The tooth will be pulled out. Otherwise, it may cause more complications. Again, the mouth, they say, is the gateway to the body. It's a lot of things that goes awry when the mouth is not the way it should be. People don't get that. So let's recap. What causes a hole in your teeth? So many different things. But the number one thing that causes a hole in your teeth is bacteria that use sugar to produce acid that attack your teeth. Now, this process is also influenced by so many different factors that are going on, whether in the environment or whether it's inside your body. Now, what do you do when you have this hole? You see your dentist. Your dentist will be able to tell you all the treatment options available to you after they must have done their proper examination. They would have looked at you, they would have taken x-rays, they would have looked in your mouth, they would have done some measurements, a whole bunch of things. And all this investigation will lead them to say, these are the options you have. So that tooth can be restored. It's not too late, if possible. But there's a level that it will reach, it will be too late. It has to be pulled out. Okay, there's something called periodontal disease. That is also a factor. Again, that will be in another video because I don't want to confuse us. I want to stick to what causes a hole in your teeth. And I believe